Welcome to a Brookwood Baptist Health exclusive. My name is Brian Pavlik. Thank you so much for joining us today. We are in the middle of March, which is the beginning of the start of 2022. We're going to get into April and May and Mother's Day and all that. But women's heart health, it never takes a break. Just because we came out of February and it was a traditional heart celebration month, it just doesn't mean that it has to stop the celebration or creating awareness. And joining me today is somebody who's going to help me talk about women's heart health. And that is a great friend, Dr. Joyce Koppang. She is with Brookwood Baptist Health as one of our cardiologists affiliated with Brookwood Baptist Medical Center. Dr. Koppang, how you been today?
Great. How are you doing today?
I'm wonderful. Thanks for taking some time out of seeing some patients to talk with us about this very important topic that I know is near and dear to you, and that is women's heart health. And I just have a few just basic questions that I think people just need to have a basic understanding of, particularly when it comes to heart health in our females and in our women. And the first thing people are going to ask is, what is the most common signs of heart disease in women? Are they different from men, or are there some specifics that you suggest ladies look for when it revolves around heart disease?
Well, honestly, I think the jury is out on that still. I know that a lot of people say that women present different with heart attacks than men, but in fact, the presentation for MIs can be different with everybody, honestly. There's been several studies to address whether it's different between a gender difference or not, and the jury's out on that. But different signs and symptoms that anybody should be looking for besides just women are things like neck pain, jaw pain, shortness of breath, fatigue. So, we have a patient population that may be fairly sedentary and may not be exercising enough to even generate enough exercise to generate chest pain. So they may present just with generalized fatigue, can't make it to the mailbox, can't do things like that. They can present with nausea and vomiting. They can even present with syncope, where someone passes out, and that may be because the artery that feeds the conduction system may be affected. So back pain, throat pain, shoulder pain, and sometimes even people present with abdominal pain. So the point is that we shouldn't dismiss any symptoms that are unusual for us, and we should take them all very seriously.
Absolutely. You mentioned, between differences between men and women, let's stick just them with the women perspective. Is there a difference between age or any type of like lifestyle demographic or so that you kind of have seen more of your patients coming in saying, you know what, Brian, there's a trend here of certain age, or maybe even like you said, the sedentary lifestyle. Just go into that a little bit more specifically, people who more are on your radar as far as possible patients down the line.
So in terms of the female population, we know for a fact, the jury's not out on that women, probably for hormone reasons and things like that, are more protected than men and present at a later age than men. When we get into the postmenopausal age, then that changes everything. So typically when we see women present with chest pain, they're often dismissed because of their age and their hormone, menopausal state. So typically before the age of 50, it's unusual for someone to present with a heart attack in a female unless they have the traditional risk factors like diabetes, smoking, hypercholesterolemia, hypertension, and family history. So typically again, if you're premenopausal, the women will start at a later age than men.
Right. I speak from experience with a wonderful wife who gave birth to 3 wonderful children, all under just high blood pressure issues and things of that nature. Is that something where pregnancy, describe that a little bit? I don't know if you see people, in stages of pregnancy, or if it's your opinion, work with your OBGYN up to a certain point, then see a cardiologist. Just kind of explain how you would kind of go hand in hand with an OBGYN or somebody in that kind of lifestyle as somebody is preparing to give birth, giving birth, kind of that postpartum. Is there a particular point where you say, as a cardiologist, please involve me at this certain point? Or is it something that you say, work with your OBGYN up to here, and then I'll take from here? Just briefly describe that, if you don't mind.
Is that somebody with risk factors or without?
Yeah, let's go with risk factors, because I know some people do have those complications. So if you don't mind, what about with risk factors?
Well, I mean, certainly, I think from the very beginning, the OBs are very, very good at telling pregnant ladies to make sure they don't smoke.
Yeah.
Probably the first thing they'll tell somebody who's pregnant is that you need not smoke. Those that do have the traditional risk factors, I don't think they necessarily need to be under the care of a cardiologist, honestly, during a pregnancy. But things that people need to be aware of during pregnancy is pregnancy in itself carries its own risk. It's a huge stress on the heart because of the increased volume load, which produces and stress on the heart. So what's probably not known in the general population is that young women under the age of 50, the number one cause for a heart attack in a woman under age 50 is spontaneous coronary artery dissection. And that is due to hormone levels. We're not exactly sure what the mechanism is. But so when a young female presents with spontaneous coronary artery dissection, which means the artery dissects and people have heart attacks, we have to recognize that as a true entity. When they're taken to the lab, the artery dissects. So there's a tear in the artery. It's spontaneous, why it's called spontaneous coronary artery dissection. It's treated differently, however, but they can have the full-blown, heart attack with heart muscle damage, sudden cardiac death. So they do need to get to the hospital, but it's treated differently, and that's usually treated conservatively, aspirin, platelet inhibitors, but not necessarily a stent. So it's pretty obvious, or not always obvious, but often obvious when you do the arteriogram that this is a spontaneous coronary artery dissection. So that's one thing that the female population needs to be made aware of, that this can happen during pregnancy, the spontaneous coronary artery dissection. The other thing that we see during pregnancy often, and it comes to our attention quite a bit in the cardiology field, is cardiomyopathies. So that can happen where the heart muscle becomes weakened. They present with congestive heart failure, and we don't know the exact mechanism of what causes this, but it can occur usually in the last trimester of pregnancy and the first 6 months post-delivery. So if a female starts developing congestive heart failure symptoms 6 months after delivering, it could be that this person has developed a weakened heart muscle or cardiomyopathy. So they need to be aware of those kinds of symptoms around delivery and post-delivery, up to 6 months post-delivery.
I love just the authority and the expertise that you come from, because I wouldn't have thought that much. It was just basically, as my wife has high blood pressure during pregnancy, what does she do? But, going into these specific things that women may experience, and like you said, these aren't things that we Google every day. I mean, these are things that may happen to you. And this is why an expert like Dr. Koppang, her colleagues, can help you with that. And why it's important for ladies, we stress it and we say it in our creative materials and just in our slogans, listen to your heart, make time for yourself. We know, Dr. Koppang, I think you would agree with this, being a mother yourself. You are the decision makers of your family when it comes to heart health and when it comes to just health in general. I'm the dentist guy at my health. My wife will do the doctor. She just doesn't like the teeth portion of it, but she will take kids to the doctor. For our ladies, when it takes time to just slow down and take care of yourself, we kind of have been ingrained about knowing your numbers and all that, but what are some screenings that you think ladies need to be aware of? And that can be by age, it could be by lifestyle, or it could just be in general. Just go over some of those screenings that you would recommend for ladies at whatever stage of life, lifestyle, or age, if you don't mind.
So obviously blood pressure is an issue. So I think when people go to the OB, blood pressure is always checked. So that is something that at all ages need to check. I see hypertension starting at age 15, quite frankly. And a lot of that depends on lifestyle, sedentary lifestyle, being overweight, things like that. And some of it's hereditary and some other conditions that they may have. For example, fibromuscular dysplasia of the kidney arteries or something like that. But nonetheless, hypertension. Diabetes, we have an unhealthy diet in America. There's plenty of diabetics in America. So one of the numbers that probably, besides just looking at the glucose levels, which is very random, is to check a hemoglobin A1C level, which gives you an idea of what your sugar is over a 3-month period. So that's always good to know, especially if you go and your sugar is 120. Whenever I see a sugar above 100, I automatically check a hemoglobin A1C just to see what the glucose control is over 3 months. So that's something good to look at. In terms of cholesterol, that's a little bit trickier because, they started in the pediatric age, starting looking at age 2, quite frankly. Pediatricians are looking for hereditary, fetal hypercholesterolemia. But when we get into the childbearing ages, we have to be a bit careful, because if cholesterol is elevated, first of all, it's often elevated during pregnancy. You have to feed the baby, your cholesterol levels go up. You can't treat cholesterol during pregnancy or childbearing ages if they're going to potentially get pregnant, because the cholesterol medications are contraindicated during pregnancy. So it's a little bit of a tricky thing to follow, during childbearing ages. And then in terms of cholesterol in the elderly, I don't think there's ever a time that we need to stop treating cholesterol. Certainly, I keep my 98-year-olds on statins as well. As far as I'm concerned, it's, should be in the water. But
There she is. She's the expert, Dr. Joyce Koppang, and she's with Brookwood Baptist Health. And I appreciate it, Dr. Koppang. Again, like we say, February has come and gone, and now people just seem to forget about Heart Month, and now it's not now time for the other awareness month. But folks, we're just encouraging you today. Listen to your heart, especially ladies. We are busy getting the kids back and forth from practices and your normal day-to-day responsibilities and all that. And yes, you are the primary caretaker in our family, and we love you for it. But especially when it comes up to things like Mother's Day and treating yourself, then slow down, take that time for yourself, really listen to your heart and do what needs to be done. Your health can't wait. Go visit Dr. Koppang, go visit some of her colleagues and all of the wonderful cardiologists we have with Brookwood Baptist Health. Make those appointments today. We're waiting for you, and you'll get to see wonderful just cardiologists and friends and people who are going to continue and getting you back to the normal road to recovery like Dr. Koppang. So I appreciate your time today, Dr. K. I will see you soon. I do appreciate all you do for us. For everybody who joined us, thank you very much. We encourage you, listen to your heart, and we will see you real soon. Thank you.